Which one of the following pathologies is most likely demonstrated in this angiogram? Anteroposterior projection. So what we see here is an anteroposterior projection of the cerebral angiogram, digital subtraction, DSA cerebral angiogram. So what we see here is this is the vertebral artery. Okay, this is the vertebral artery. And what you see here is this is the PICA, origin of the PICA. And here you see the aneurysm. Okay, this is the aneurysm. And this vertebral artery then joins with the, forms the basilar artery here. And then you see here, what you see here is the basilar bifurcation, basilar artery bifurcation into posterior cerebral artery. And then here you have the superior cerebellar artery. So these are the terminal branches of the basilar artery. This is the P1 PCA. That is the P1 part of the posterior cerebral artery. And this is the superior cerebellar artery, the terminal branches of the basilar artery. And then here, this is the vertebral artery, and here is the origin of the PICA. So most of the time, the PICA aneurysms are usually seen at the vertebral artery PICA junction, or the origin of the PICA. Okay, so what we see here is a PICA aneurysm. So most aneurysms of the vertebral artery, they take origin at the PICA. So especially when the origin of the PICA falls at the apex of a superiorly directed curve of the vertebral artery. So that is why if you see these aneurysms are pointed upward. These aneurysms are directed upward. So, so that is why they point upward, and usually they communicate widely with the PICA. The size of the territory supplied by the PICA varies widely and will influence the best approach to aneurysm therapy. This is again the cerebral angiogram, which is showing this is the vertebral artery, the two vertebral artery joining to form the basilar artery. And here you have the PICA. So this is the PICA. And this is the basilar bifurcation into P1 PCA and then the superior cerebellar artery. And this is the ICA branch from the basilar artery. And apart from this, we will have multiple labyrinthine branches on the pontine branches in the basilar artery. So the various segments of the PICA. There are almost 5 segments, the from P1 to P5. So P1 extends from the origin from the vertebral artery. It lies anterior to the medulla and goes up to the medial part of the olive. Medial part of the olive at the point of origin of the hypoglossal nerve rootlets. Okay, at the point of origin of the hypoglossal nerve rootlet. So that is the extent of the P1 segment, which is called as the anterior medullary segment. And then is the P2 segment, which is called as the lateral medullary segment, which extends between the medial border of the olive and to the lateral border of the olive. And this segment P2, it lies between the 9, 10, 11 nerve rootlets and the 12th nerve rootlets. So that is the P2 segment or the lateral medullary segment. And then we have the P3 segment, which is called the tonsillomedullary segment. It is called the tonsillomedullary segment because here is the tonsil and here is the medulla. This is called as the tonsillomedullary segment. So here you have the first loop. This is called as the caudal loop. This is the P3 segment, and this P3 segment extends up to the middle of the cerebellum. So there is a caudal loop here. Okay, this is the caudal loop. So this is called as the tonsillomedullary segment. And then from the middle of the cerebellum, it goes up to the floor of the fourth ventricle, where it forms a cranial loop. So this is called as the tilo-velo-tonsillar segment. This is called as the tilo-velo-tonsillar segment. Okay, this is called the tilo-velo-tonsillar segment. And then from this is the cranial loop. So the cranial loop is at the P4 segment and the caudal loop is at the P3 segment. And then it enters into the cerebellar fissures, and then it forms the cortical branches. So that is the 5th segment. So totally there are 5 segments of the PICA. So this is the lateral view or the sagittal view, and the same thing in the posterior view. So this is the kind of view which we usually see when we do a suboccipital, when we put the patient in a prone position and do a suboccipital craniectomy. So this is the anatomy which we usually see. So we start seeing from the P2 segment. The P2 segment and then the P3 segment, the caudal loop, and then we have the cranial loop. So just a comparison of the lateral and the sagittal and the posterior view, and correlate the various segments of the pica. So again, repeat, there are 5 segments. The first segment extends from the origin of the pica from the vertebral artery, which lies anterior to the medulla. Hence, it is called as the anterior medullary segment, and it extends up to the medial border of the olive. The P2 segment extend, that is the medial border of the olive, is the site of origin of the 12th nerve, hypoglossal nerve rootlets. And the P2 segment extends between the medial border of the olive and the lateral border of the olive. And this segment is called as the lateral medullary segment and lies between the 12th cranial nerve rootlets and the 9th and 11th cranial nerve rootlets. And then the P3 segment extends from the lateral border of the olive, and it goes down to the tonsillar part and then goes up to the middle of the cerebellum. So this is called as the tonsillo-medullary segment, where we also have a caudal loop. We have the caudal loop here in the tonsillo-medullary segment. And then is the P4 segment, which goes up to the floor of the 4th ventricle and roof and forming a cranial loop here. This is called as the tilo-velo-tonsillar segment. And after that formation of the cranial loop, it enters into the cerebellar fissures and forms the P5 segment, that is the cortical segment.